Hi everyone, welcome to Change Begins, where we bring you up to speed with this week's stories of change driven by citizens, along with an analysis by subject experts who delve deeper into the issue at hand. Continuing with our COVID series, this week we'll be talking about dealing with the pandemic, things that COVID patients have to deal with, whether it's access to the health infrastructure or dealing with the stigma and prejudice that come with the virus. Joining us today is senior bureaucrat V Ramesh, along with advocate Mishika Singh and psychologist and COVID survivor Arshita Kapoor, sharing their insights on dealing with the pandemic. Mishika and Arshita started petitions on change.org to challenge the status quo and seek answers to the problems they saw people around them face during the pandemic.
The pandemic is not like an epidemic.
This is V Ramesh, a doctor by education and a bureaucrat by profession. He currently serves as the additional chief secretary to Y.S. Jagan Mohan Reddy, the chief minister of Andhra Pradesh. He's talking about challenges in dealing with the pandemic from the perspective of an administrator.
I think the biggest challenge is early detection of the infection. The strange thing about this infection is though a person is infected, he does not manifest symptoms, he or she, for about 5 to 7 days, sometimes as late as 14 days. Majority of the people who are infected also don't exhibit symptoms. So you have two problems. I'm infected, spreading infection, but I do not know I'm infected. So I go around my work normally, I meet people and I spread the infection. The other is I have the infection and some symptoms, but I don't have very serious things, so I don't seek medical attention. Now this infection is spreading fast, essentially on account of this reason. That is why a lot of people seem to think that this is like any other disease. What we are noticing actually is, unlike in the West, where predominantly this infection attacked or targeted the elderly, in India, it is not sparing anyone. In fact, majority of those infected in my state of Andhra Pradesh is between 20 and 45 years of age group.
Being a COVID patient is not easy. It's quite a challenge. The fact that you are a COVID patient mentally is very, very stressful, more than sometimes what the disease is actually causing you. The mental stress that you have because of the term COVID and the fact that you are infected is a lot more than the other effects that you have physically.
Arshita Kapoor is 27. A psychologist and a college advisor from Delhi, she contracted the coronavirus around the end of May. Over the next few days, she realized living with COVID had more to it than just the physical toll it took.
If I talk about my experience as a COVID patient, then something that really stood out for me was that people sometimes don't understand what you are already going through. There is a lot of stigma attached to COVID. People don't understand that once you are a COVID patient, then it is not like you are a COVID patient all your life and you come out of it and it's only a 15, 20, 21 or even a month long process after which everything is normal. When you are a COVID patient, you want some help and support, which thankfully I got, but there are many people around the world who don't get that help and support, which is very, very important. People look down upon you. They don't want to deliver groceries, they don't want to give you vegetables, they call you certain names, and they look at your house in a different kind of a manner, and all of those things happen, which is not very nice, which is why I also started the petition that we shouldn't be shaming COVID patients, and that is something that is very, very important.
Mr. Ramesh says the stigma around COVID is baffling, especially given the fact that literally the entire world is united in being vulnerable to the virus.
When the entire humanity, all 7.6 odd billion people, face one common threat, and this is the time that should really be uniting us. We all have a responsibility for each other so that we don't infect each other. The stigma seems to be worst in the middle classes and also the richer, those who live in quarantined environment, I mean gated communities, multi-storied apartments in the urban areas who are relatively affluent. People are scared. I mean, I've had many people tell me that they are scared of getting themselves tested, though they feel that they have symptoms suggestive of COVID, because if they are seen or known to be getting tested, let alone positive, just the test itself could ensure ostracization. They may be asked to leave the apartment. You cannot live with us. Now, this is the most important demand actually, because unlike, as I said, the other chronic diseases that carry stigma, you cannot afford to stigmatize this disease. This is, as I said, is an equal opportunity infection. It can infect anyone. The virus is an equal opportunity virus, so it can infect anyone. Second is, it seems to practice socialism. It doesn't differentiate rich, poor, men, gender, sexual orientation, location.
And yet, the stigma that COVID patients have to face is very real.
Actually, I mean, I've been seriously thinking about this. I mean, media, I believe, has not done enough. It needs to educate, inform, and mobilize to action rather than create a sense of despondency, create a sense of feeling of depression, and or create a scare and an alarm in which people believe that government has failed, it can't do anything properly. Second is, of course, government certainly needs to do a lot more in public information. Now, social media is one way, the public media, the electronic and print media is another. Then more importantly, people like this what they hear from the government directly, either from the leadership, the topmost leadership, really need to talk a lot more with people. And also in cities, in the slums particularly, the mics that go around telling people, this is, during the election time, it used to be done when I was younger. People say vote for so and so. Similarly, educate people. Now, don't vote for coronavirus.
The challenges thrown up by a pandemic with these peculiar attributes require an infrastructure that is strong enough to serve a large population. And this infrastructure needs to be accessible to people during these uncertain times, especially given the enormous amount of misinformation around the pandemic.
I started this petition when I realized that people don't...
Mishika Singh is a lawyer from Delhi.
There was an absence of information on where they could get their test done. There was an absence of information on where a person could go, which hospitals were treating COVID patients, which hospitals were doing tests, which labs were taking samples. And this was sort of creating a panic situation amongst people around me, because even if they had a common cold or if they were showing some symptoms, they got very scared because they didn't know what the steps were to be followed after that. I stay at home where there's a small baby and my parents are both over 60 years of age.
When she realized there was an urgent need for credible, useful information about COVID treatment, she started a petition on change.org urging Union Health Minister Harshvardhan to set up a centralized COVID database with all information on dedicated COVID hospitals, numbers and availability of beds, and the protocols needed to be followed by patients all in one place.
So I realized that maybe if there was information that was accessible, maybe the situation could be better dealt with. Having a centralized database, I think, would help in taking care of the situation, as there would be access to information, especially for people who were working in seasonal industries, who sort of lost any reason for staying in their place of occupation. They traveled through various states, so not having a centralized database really affected their access to healthcare, as they were going through different states, and for every state before entering, they had to find out about what was happening. In case something happened to them in that state, who could they contact, where could they get a test done, which hospital would entertain them.
Mr. Ramesh says the Andhra Pradesh government is working on putting together just such a database.
I'm strongly in favor of that. I mean, I've just yesterday At our state level, we decided that we should map out all the hospital beds, both in the government sector and the private sector, and all the materials and all the essentials. Whether ventilators, oxygen, these are essentials.
Yeah.
The medications, the personal protection equipment in each of these hospitals, and the bed management need to be centrally monitored at the district level, and then verified at the state level, and data made available at the national level. Because now this becomes a dirty business, because there is too much demand and too little supply, and so then I pick and choose the patient, and I pick the richest man, or the most powerful man, or the man who's willing to pay the highest price. Now, I think this is extremely unethical in a matter of life and death, because I would like to believe, notwithstanding statements to the contrary by very responsible institutions and responsible individuals, this is a long haul. This infection will be with us for some time, may not be in the same intensity, would be quite long. And then people who are claiming that vaccine is around the corner, or simply trying to delude us, there's quite a long way, because the standardization of producing, unless they want to kill us all with viral infusion, it'll take quite a while. At least I foresee nothing, at least 1 year before something happens.
Dealing with this unprecedented global pandemic has various aspects. We heard about them from the perspective of the state as well as that of the citizens. Citizens who decided to initiate change. If you think you would like to challenge the status quo around you, join the conversation on change.org. You can also find us on Facebook, Twitter, Instagram, and YouTube. That's all from us this week. This is your host, Mahim, saying goodbye.